None of us like to see price increases on those things that really are essential for our life, like food and gas and housing and healthcare expenses. Having to pay more for these items, especially when we're on a fixed income, is very, very painful. And unfortunately right now, Medicare costs are continuing to rise. Why is this happening? How often is it happening? How much is it happening? And what you can do about it will be the subject of this video. As we look at this topic of increases happening right now in Medicare, and especially with supplemental plans, I want to show you the 5 reasons why it is this is occurring. Number 1 is because of medical inflation. We have been dealing now for several years with this problem of inflation. And right now, inflation is a little bit better under control, but medical inflation has really far exceeded that of the general types of things that we're getting. Number 2, post-COVID use is a huge problem right now. For those COVID years, many people put off getting services, surgeries and such. And so now, after COVID, we're seeing more people getting those surgeries and taking care of those medical issues that they actually had postponed for a while. So much higher use since COVID. Number 3, a growing use, and watch this, of expensive medications. A lot of meds today, brand name, very expensive, especially some of your GLP-1s that are used for diabetes as well as weight control. Very expensive, a high use of those right now. And then number 4, higher utilization of mental health services. Medicare began to cover more items for behavioral health, and so people are using those services, of course, which is going to lead to higher medical loss ratios. And then number 5, we also have, as we know, an aging population. People are living longer, and those of you that are in Supp plans are in Supp groups, and so those groups are aging, therefore typically using services more frequently. So those are the reasons we're dealing with some of these cost increases. Now, every plan is going to be a little different as far as the amount of the increases, for sure. Different states, different plans, all those kind of things. But as a general rule, what we're seeing right now across the board is anywhere between about 10 to 40% on the Supp rates. Again, the 40% is going to be high. That's only in a couple different states. But the point is, we have seen this a few times. But right now, it's in the average is going to be around that 10 or 15% price increase. So what are we seeing as that relates to dollar amount? We're seeing price increases on Supps moving in the low range of about $15 a month, upwards to about $60 on a monthly basis. So that's pretty substantial. All right, so that's the range presently. All right, so that's the reason, and now we have the range. But now let's talk about the remedy. How can we get some relief from some of these price increases that are occurring? And of course, the key would be this statement right here: switching plans, notice if or when possible. So the first one we have to address, can we switch a plan, and when is the best time for us to be able to do that? So that's what I'm going to really be spending the rest of this video talking about this question, to make sure if it's you're able to switch a plan and save some money, when can you do that? All right, so first of all, what are our options for switching plans? And so the first one would be switching Supp plans, right? Which means you may be on an F plan and you want to move to a G plan or to an N plan. That'd be a switching of a plan type. And then also switching Supp carriers or insurance companies, right? So you can change carriers. Sometimes someone may be on an F plan and they move to a G plan and stay with the same carrier. Or maybe in their best interest to not only change the plan, but also change the carrier. And that would be this, where it means we're going to switch both. And again, this varies state to state, plan to plan. So again, these would be our options. And then we also have another option, and that's switching from a Medicare supplemental plan to a Medicare Advantage plan. Of course, these are called C plans. And there's some people that may decide that they want to do that if that's in their best interest. Now, I want to remind anyone watching this, if we make a move from a Supp to a C plan, not only are we switching plans, but we're also switching how that plan is going to be administered. Because remember, when you switch to an Advantage plan, you're going to have some kind of a network that you'll have to deal with, either an HMO or a PPO. When you're on your Supp plan, you didn't have a network. You had what we call an open access system. Someone that has a Medicare supplemental plan can go to any provider, any hospital, any doctor, any surgeon, any specialist, as long as they take Medicare. So we don't deal with networks with Supps, but we always deal with networks when it comes to Medicare Advantage. Doesn't make them bad, it just makes them different. Not every doctor is going to be on the Advantage plan. Certainly not all hospitals may take your Advantage plan. So again, we're going to have a few limitations when it comes to the Advantage plans. But that is an option, a way you may need to save some money. All right, and then also switching from an Advantage to a supplemental plan. Now again, over here we were talking about trying to save some premiums. This certainly wouldn't be saving monthly premiums, but sometimes people decide, I don't want to be on that Advantage plan because of networks, because of pre-authorizations, because of all the annual changes going on, and they may want to move to a supplemental plan. Now they're not going to save money as far as monthly premiums go, but if they had a serious illness or something, they could actually save substantial money. So I just put that in the list because this would be a possibility of switching as well. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now this video is primarily about those of you that want to switch your plans, but it's imperative really that I give some instruction about those of you that are going to start your MedSup plans, because there's different rules, and so you have to be aware of this. So it's very, very critical. So bear with me for just a minute, because I think it's important that we talk about the rules for starting Medicare supplemental plans. All right, there's actually 3 different ways, times in which we can start these plans, brand new for the first time. The first one would be if I'm new to Medicare A and B. All right, so this is someone that's decided to start Medicare at 65. Their spouse are no longer working. They're going on Medicare at 65. Let me just give you a quick example. Let's say someone's birthday is today. I'm shooting this video on May the 7th of 2025. And let's say someone has a 65th birthday today. That means they could have started their Medicare A and B at 5/1 of 2025. And they made the decision to do that because, again, they were no longer working, spouse wasn't working, so they're going on Medicare. And so what we have, new to Medicare, we can start a MedSup plan during a period of time which we call the Medigap OEP. OEP stands for Open Enrollment Period. And here's what matters about this Medigap OEP. It only lasts for 6 months. And this is a 6-month window of time where we can get any Medigap policy that we qualify for based upon age. If we're starting Medicare after 1/1/2020, then we have 8 different plans that we have available to us. We can do MedSup Plan A, or B, or D, or G, K, L, M, or N. There's 8 of them. And so I can get those plans, and I can get those plans under what we call a guaranteed issue basis. You make application, the insurance company cannot deny it, regardless of your pre-existing conditions, regardless of really any health conditions, regardless of meds. They have to approve your policy. And all states have this law. It's a federal law. And so you can get this policy. You apply, they have to approve. They cannot deny you. But again, this 6-month window is the window of time for 47 states. Now, if you live in New York, Connecticut, or Massachusetts, it's different. But everywhere else, you only have 6 months to get this Medigap policy without any underwriting, and they still will have to cover your pre-existing conditions, and they have to approve the policy. So it's a very, very important window of time. All right, so that's A and B, 6 months. Now, practical standpoint, you don't have to wait till your B date begins. You actually can apply 3 to 6 months in advance. All right, but it would go into effect when your B went into effect. And all I'm trying to teach you is this 6-month window. If I go beyond that now, unless again I live in New York, Connecticut, or Massachusetts, I'm going to have to medically qualify to get a Medigap policy. So in this example, the 6 months would be, it starts in May, so that'd be May, June, July, August, September, October. So May 1 to October 31, I can apply, and they have to approve. But after that, November 1 on, now I'm going to have to medically qualify to get that Medigap policy. That's why I'm saying this is a very, very important rule. Number 2, let's talk about those who are new to Medicare Part B. Well, why would this happen? Well, this is someone, and let's use this as our example, who was still working, or their spouse was still working, and they decided to not go on Medicare yet. They had a good group plan. Maybe the spouse was younger and covered by the plan, or children covered age 26 on the plan, so they stayed on the employer-provided plan. And as long as there's 20 employees on the payroll or more, you don't have to do anything with Medicare. You don't have to do A, you don't have to do B at all. Now, you may want to do A only if you're not contributing to an HSA. If you have a health savings account, an HSA, don't do anything, A or B. But as long as you don't have an HSA, I would encourage someone in this scenario to go ahead and enroll into A only. Have that A only. and Medicare in this position would be the second payer to your group plan, but it's still a good thing to do unless you have an HSA. So we took A only, and our A only date was 5/1 of 2025. But we kept working. And so let's say we work for 2 more years, and then we decide to retire, or our spouse retires. We lose the group plan, and now we're going to pick up Medicare B. And so 2 years later, that would be 5/1/2027. And all I'm trying to teach you is this Medigap OEP is now tied to that date. So if you don't start Medicare at 65, you have not lost this opportunity because you've delayed taking your B. And once I start my B date, then again, I had that 6 month, whether I do it at 65 or 67 or 79, it doesn't matter whatsoever. All right, that's starting Medicare, no underwriting involved during the 6-month window. And then lastly, anyone who's new to Medicare Part C. Part C. Now, Part C plans are called Advantage plans. Advantage plans are private health insurance companies that actually replace Medicare for you. You enroll into A and B, but now you're underneath the umbrella of a private health insurance company that puts together what we call a managed care plan for you. And here's what happens. If you're new to that plan, meaning you started it at 65 and you have that A and B date of 5/1/2025, you have what's called a trial right. And that trial right lasts for 12 months. And so if you're on that Advantage plan anytime, for any reason, during that 12-month window, you decide, I don't want to be on this Advantage plan. I don't like networks. I don't like pre-authorizations. My doctor dropped the plan, or whatever reason you want to switch. What happens is during that 12-month window, you actually can pick up a Medicare supplemental plan. And so this Medigap OEP period, it's really any time for those first 12 months. And so we move from the Med C over to pick up a Medicare supplemental plan. It's still guaranteed issue. The company has to approve you. All right, so that is new to Medicare. Now, as we look at starting Medicare plans as well as switching, you have to understand that when we look at the premiums, those premiums are going to vary throughout the country, and there's a reason for that. Because federal guidelines say that there are 3 different pricing structures or pricing systems or methods to determine the initial premium on a Medicare supplemental plan, and that's going to vary by state. There's 3 of them. The first one I want to look at is what we call the community rated plans. And what happens is there's 9 states in the country that mandate that the insurance companies offer MedSup premiums and their MedSup plans, and their premiums can be based upon community rating. And you can see the 9 states: Arkansas, Connecticut, Idaho, Massachusetts, Maine, Minnesota, New York, Vermont, and the state of Washington. Those 9 states mandate it. So when we look at those policies, what's happening, when I talk about the initial premium, what that means is what you'll pay when you first go on the plan. And in this situation here, regardless of your age, regardless of your gender, so in other words, this doesn't matter whatsoever, doesn't matter at all, and regardless of a health condition, everyone initially is going to get the same rate. So that means that the 65-year-old pays the same as the 75-year-old. 85-year-old pays the same as the 75-year-old. Doesn't matter because it's community rated, which common sense tells you those that are younger are paying a little bit more, and those that are older, this is a pretty good value. So the initial premium is always based upon basically a geographical area. It could be county, could be zip codes, but it's a geographical area. Anyone getting a plan around that same time in that same geographical area is going to get the same premium price. Okay, the next issue would be, how about premium increases? Will those go up? Absolutely. Everything goes up. And so what happens, though, is when you get a Medicare supplemental plan, you are getting you're buying into a group. And so you could be thousands or tens of thousands of people that are actually in the group. And the only way we'll ever see a price increase is if the whole group goes up. And that's going to happen, because what happens with all Medicare supplemental plans is this. You as a policyholder, you pay in your premium, and you pay that in on a monthly basis. You did that, pay the premium to transfer the risk of the gaps in Medicare to that insurance company. So what do they have to do? Well, they got to pay money out. We call that claims. So what's happening in all MedSup groups is money goes in, money goes out. So company has to pay out those gaps in and out. And so what happens eventually is claims will exceed the premiums coming in, which means that group is now losing money. They may be losing 7%, they may be losing 10%. And they have to take this loss, and they go to the insurance commissioner in the state, and they'll ask for a rate increase to get back to where they were when it started. So they'll ask for a 7% increase. Normally the state will approve that, and everybody in that group, whether you're 75 or 69, doesn't matter, everybody everybody is going to go up because we have that same group increase. So again, everyone's going to pay the same in either way, initially as well as premium increases. So that's what happens in 9 states. All right, that brings us into our second different method of pricing, and that's called issue age. And there's 4 states that mandate this. Now, there may be other states that certainly would allow it. They don't mandate it. And those 4 states are Arizona, Florida, Georgia, and the state of Missouri. So if you live in those states, you are definitely going to have an issue age policy because the insurance commissioners mandated that. All right, so what does that mean? Well, the initial premium will be based upon how old you are. So the 65-year-old is going to pay less than the 70-year-old. All right, and so it also can be gender related as well. So typically, male prices are more expensive than female prices, and then certainly it's going to be based upon your zip code for sure. All right, and so geographically, our gender as well as our age determines the price that we pay initially. But here's what happens. As far as increases go, there can never be any age increases. There can only be what? Group increases. So this will never go up because of age. Will it go up? Absolutely. Everything goes up. The same thing I shared with you earlier. Remember, money goes in, money goes out. And once that group is losing money, then you're going to get a price increase. So these also go up 5%, 7%, 12%, depending upon really how large a group that you have and how stable is that rate going to be. And so my whole point is these are going to go up as well, but it's not going to go up anymore because of age. It only goes up because everybody in the group went up. And then that brings us to our third one. And as you'll see, this is what the majority of states are doing. The insurance companies will opt for this option. At 9 states, community, 4, we had issue age, and the other 37 are going to have what we call attained age. Now here, these states don't mandate it. The insurance companies, they actually leave it up for them to choose, and this is the one that the majority of them are going to choose. All right, and so what we have here when it comes to that initial premium, again, it's going to be based upon our age. So again, the 65-year-old pays less than the 70-year-old. It's also going to be based upon our gender, for sure, right? And geographically, the zip code, the county, whatever is going to matter. So that initial premium we pay as we come into this group is going to vary for sure. Now, will prices go up? Absolutely. Everything goes up. But here's what happens. With these, we're also going to get an age increase every anniversary of our policy. So if I started at 65, when I get to 66, I'm going to have a slight increase. When I'm 67, again, I'm going to have a slight increase. So every year, we're going to get an age increase for sure, it's a slight one. And then we also can have a group increase. And so, back to my box, what happens? Money goes in and money goes out. Now, in this, what happens? If I'm over here at 65, and let's say I'm paying $120, when I'm 66, I may pay $125. So these go up a little bit every year based upon birthdays. So these start the lowest. Issue age is kind of medium, and community is going to be the highest. But I want to make sure you understand is that all of these are going to go up. Sometimes someone will say, well, issue is better because it doesn't have age increases. Well, it still has group increases. And so what really gives the stability of the rates is how large of a group you're in. More policyholders, that risk is spread out. So that's really what gives us stability. Not so much the age, the rating method, but how many people are going to be in our group. I use the illustration of if I'm in the ocean and I'm in a canoe, I'm going to feel every single wave in that ocean. Small boat, and I'm going to feel the impact of the waves. But if I'm in a cruise ship, I'm probably hardly sometimes even know you're in the ocean. You don't feel any of the impact. And so that's what I mean when I talk about a group. What I'm looking for is a large group so that the health issues, the cancer, joint replacements, everything going on in that group is spread out to more policyholders. So regardless whether it's community, issue, or attained, what really matters is how large of a market share does that company have in your particular area. We've just found the most stable companies have a larger group. Okay, so that's really what matters. But again, we'll have a slight age increase, and then group increases can occur as well. All right, so now let's close this out with the rules when it comes to actually switching Med-Supp plans. Because there are some states that give you some opportunities where you do not have to go through underwriting. And so it's very important for you to be aware of this. And so we call the majority of these states birthday rule states, where again, just like when we started Medicare at 65, we had that 6-month window where we didn't have to go through underwriting. What we have now are states that say you can switch plans and you don't have to go through any underwriting. So I'm just showing you this chart of the states that offer these kinds of switches. Okay, California, You'll see date of birth. What they say there is 30 days before your date of birth, 60 days after. You're in this window of time where you can go to any type of a carrier, any insurance companies that's writing plans in California, and you can go to a like plan or to a less plan. So if I'm on an F plan, I can move to an F, a G, or an N. If I'm on a G, I can move to a G, another G, or an N. If I'm on an N plan, I can move to an N. I can't move up to a G or to an F. I have to go end to end. So it is like to like or less to less. You can't increase in coverage. All right, so that's how California works. So I want to make sure you're clear as we go through this chart. I just want to flip through some of the states so you're clear on how this works. Connecticut, now they don't tie it to date of birth. It's actually year-round, continuously. You can go to any carrier and all the plans would be available to you. The state of Idaho, they start with date of birth and say for the next 63 days you can make the switch, any carrier, again, like to like or less to less. State of Illinois, a little unique here. Date of birth for the next 45 days you can make the switch, but only between the ages of 65 and 75. And again, here, notice you have to stay with the same carrier. You can't change to any carrier, but you can go like to like or like to less. All right, state of Kentucky, again, date of birth next 60, same thing, any carrier, like or less. Louisiana, you'll notice here it's 63 days after the date of birth, but look what they do. They do like Illinois. You have to stay with the same insurance company, but again, it would be like or to less as well. State of Maine, again, just like Connecticut, year-round you can do this. Any carrier, like to less. State of Maryland, 30 days after your date of birth, so a very short window of time. But again, any carrier, and then you can do like to less. And then the state of Missouri, a little bit different here, because notice it's not date of birth, it's tied to the anniversary of your policy when you started that. So 30 days before, 30 days after, again, change carriers, any carrier, and you can go like to like, not like to less. So in the state of Missouri, you'd go G to G, N to N, F to F. You can't change plans, but you can change carriers to get a better rate. All right, the next group here, just a few more states here. I want to be clear on this. The state of Massachusetts, just like Connecticut is and New York is, continuous. Any carrier, all the plans available to you. State of Nevada, date of birth for the next 60 days. Again, any carrier, like to less. New York, continuous, again, any to all. And then we have state of Oklahoma, date of birth for the next 60 days. Choose any carrier, again, like to like or like to less. Oregon, again, 30 days before, 30 days after, that 60-day window, kind of like Missouri did it, but it is tied to the date of birth. Missouri was tied to the anniversary of the policy. Again, you can see any carrier, like or less. State of Utah, they're brand new in this, actually just started just recently, 60 days after date of birth. And again, notice this, got to stay with the same insurance company. Can't change carriers, but you can change plans like to like or like to less. And then the state of Virginia, this is going to affect July 1. I told you I'm shooting this video May 7th, so this hasn't happened yet, but it is going to happen. Date of birth, next 60 days, any carrier, like to less. And then lastly, the state of Washington. Notice it's year-round. Now again, you got to be on a MedSup plan for sure, but as long as you're on one, you can do it anytime you want. Any carrier would be available, and then again, that move would be like to like or like to less. All right, and so again, those of you who live in these areas, it'd be something you can do and take advantage of. Now, if you have good health, you can change a MedSup plan anytime you want. We just have to go through underwriting, so we have to ask you health questions, check your medications, see if you're in good health. Don't feel like you're bound just to these dates. If you have bad health, then again, this would be probably the only one in time that you can make these switches. All right, so I hope that was helpful. I know it was a mouthful for sure, but some of you may want to switch. And again, it's very involved. We can see the rules, especially we have underwriting, different things we have to go through. And so we'd be delighted to serve as your Medicare broker. If you call our 800 number here, toll free, you would actually come into our switchboard. By the way, I've trained every single agent that's with our company, spent lots and lots of hours training them, so they have a passion for doing what is the right thing for you, and they'll give you unbiased advice and share with you the different companies that we represent in every market all over the country. We'd be happy to serve as your broker. So you call in. Our switchboard is open 7 a.m. to 7 p.m. Monday through Thursday, and then 7 a.m. to 6 p.m. on Fridays. Closed Saturdays and Sundays, of course, but you can always reach us. We'd be delighted to help you. We're brokers, so we'll share with you lots of different options. Our services are totally free to you. And not only do we help people set up with their MedSup plans, but we help people enroll into Medicare, and we'll walk through the whole process with you. And then we have our own customer service team. So if you have any problems down the road, you can reach out to us and we'll assist with that. Another way that you can do this is that we own this company called MedigapCompare.com, and be delighted for you to to check that. So up here, you're going to get a direct agent help. Here, this is done really self-enrollment online. So if you want to look at prices and different aspects, this is a very good self-help tool as well. So we'd be delighted to serve you in any way that we could.